Good afternoon, everyone. I will call this regularly scheduled meeting of the Public Safety and Emergency Management Committee to order. Today's date is Thursday, March 15, 2018. My name is Alondra Cano, and I am the council member for the 9th Ward and also the chair of this committee. And today we are joined by council members Jeremiah Ellison, Council Vice President Andrea Jenkins, Council member Steve Fletcher, who is also the vice chair of this committee, council members Philippe Cunningham, and council member Lene Palmisano. So we are indeed a quorum of this committee, and we will conduct the committee's business today. On today's agenda, we have one public hearing, 2 consent items, and 5 items for discussion. So before moving forward the consent items, are there any questions on our agenda today? Seeing no questions, I will go ahead and move the consent agenda, which is 2 contract amendments. One is a contract amendment with the Minnesota Homeland Security and Emergency Management for bomb disposal units. And the second item is a contract with the University of Minnesota for Minneapolis Police Department bomb detection at TCF Stadium for football, soccer, and homecoming events. All those in approval, please say aye. Aye. And that item moves forward. So with that, we will go ahead and move on to our public hearing. So this is a public hearing for the reappointment of our Director of Emergency Management. And we shall just go ahead and have that public hearing now. So if there's anybody that's here to speak on this item, please go ahead and come to the front of the room, and we will conduct our public hearing. Anybody here for this public hearing on the reappointment of our Director of Emergency Management? Nope. Okay, we shall close the public hearing. And does anybody want to speak on this item, or should we move forward and approve it? Do you want to say something? Okay, wonderful. I will recognize Councilmember Philippe Cunningham.
Would it be possible for Mr. Barrett to be able to come to ask questions as well, or?
Yes, definitely. So if we can have our director please take the microphone, and you can feel free to open up, or we can go ahead and dive into questions.
Happy to field any questions. Just for the record, Barrett Lane, I'm the Director of the Office of Emergency Management. Councilmember.
Thank you. I was curious, what role did the Office of Emergency Management play in the 4th Precinct occupation?
So during the 4th Precinct occupation, the police department asked us to open the Emergency Operations Center, which we did. So during the course of that time period, we provided support and actually not a whole lot of support, but the Emergency Operations Center was open and provided that level of support that was requested during that time. So really, it's the same type of mission that you saw during the Super Bowl. Mm-hmm. So our job is to provide that second line of support to incident command if they request resources or authorities or issues of that nature. So that was our role.
Yeah, so as a follow-up question to that, so in the COPS After Action report, it said that it says that although that the EOC was activated and MPD established an incident command, there was another Joint Information Center that was established and then operated separately. And so that led to some miscommunications. I was just wondering, reflecting on the experience of the 4th Precinct occupation overall, what do you feel are some of the lessons that you learned?
So I think it's really more learning from system-wide on this. From our perspective and ultimately functionally, that what was called a Joint Information Center was what we talked about, the policy group in training earlier before the Super Bowl. That's really what that group was doing. Was it mislabeled as a Joint Information Center? Yes. So, I mean, number one is, of course, if we have these technical terms, we need to honor them because they mean things to other people and they help frame expectations about what we're doing, not only within our walls, but beyond our walls. So that Joint Information System, Joint Information Center is a term of art. Was it clear what they were ultimately doing to me? Yes. And I think that the debate that should be had at some point in time, and I think the thing that really posed in that whole conflict, not so much conflict, but the whole situation, at what point in time And how do policymakers have policy control over things that at the same time honors the delegation of authority to tactical commanders in the field? And that's an inevitable push and pull in these things. And, you know, is this one instance where things might have been done better? Possibly, but that's really for the chief to address ultimately, you know, is how does that work from his tactical level? But I think really to have a strong policy group that knows its swim lane, to have a joint information system that is what it is, and ultimately the EOC and incident command system working as it should, were the lessons that came out of it. And a lot of that got implemented in exactly how we brought it forward into the Super Bowl. So we had that report in mind as we went forward into Super Bowl preparedness. And as you know, I mean, our joint information system led by our communications team, that's what that was.
Yep.
The policy group, we had that conversation. So part of this was just a realigning expectations around those roles and responsibilities. And I think that we did a pretty good job of bringing that forward into that next event.
I so agree. When I was reading through it and reflecting on it, just really seeing those changes and how the Super Bowl gave an opportunity both to reflect on some of the previous experience as well as learn new things as well. So I just want to say thank you very much for your service, both as a council member and also in this role. And my last question is, what is your favorite part about this job?
I think my favorite part is one of the few jobs that you can ever have that you can talk to a frontline firefighter and the President of the United States on the same day. You know, to have that breadth, scope, responsibility, and trust, because that happens. It doesn't happen every day, obviously, is a tremendous privilege. It's a tremendous honor, and frankly, is one of the most exciting things about it. You're welcome.
Thank you, Director. We have another question, but before that, I just wanted to make an announcement. In our discussion items, please note that we will take the fourth quarter body-worn camera metrics and report as the first item of discussion. So folks in the room, if you could just prepare for that. So we'll go ahead with a question from Councilmember Fletcher.
Thank you, Madam Chair. Director Lane, you've had a chance now to sort of learn our capacity and our strengths through a few different kinds of events, including the Super Bowl and tornadoes and the 4th Precinct and lots of other stuff. What do you see as the sort of key things that you want to accomplish in the next 2 years? What are you looking forward to and that you see as capacities that we still need to build as a city?
So, you know, our plan is to build out our system. So we're really under, let me just back up a little, really still under a long-term workout program. And we're driving toward being an organization that's capable of accreditation by the end of next year. So, I mean, that's the overall objective. And we're making good progress along those lines. I think the thing that we really need as an enterprise to focus on, and certainly it's going to be the course of the next 2 years, and even as we roll forward toward the Final Four, is to make sure that we continue to define those spaces where incident command does their business, where the EOC and the incident coordination does its business. And again, this is really the same thing we just conversation with. We need to continue to strengthen and support and invest in those capabilities because we have to be able to surge up, but only as much as we need to. We have to be able to drop down when we can. I mean, that's just efficient use of resources. So to us, pretty much on the front and center is going to be making sure that we have that surge capability within the organization. We were able to build that up for the Super Bowl, but that really didn't exist at that level up until then. How do we sustain that? How do we compensate the folks that are in that? How do people that are in public works and public health and communications and otherwise get deployed and then sent back to their home organizations? How do we create the space for them to be trained so that they can be competent? It's important to me that if we ask people to do work, that we provide them the opportunity to become competent in doing what they're asked to do. How do we create the space to do that while actually accomplishing all the other work that we need to do, right? So that's the conversation that we're going to end up having over the course of the next 2 years, because inevitably, if we want to be able to field a team like we saw during the Super Bowl, and if we want to be able to respond at the level of expectation that was set by that bridge collapse, we have to make those investments. And a lot of that is soft. It's not necessarily that we need, setting the whole grant funding side of things aside, we don't need $10 million or something, but we do need bandwidth within the organization to repurpose and reorient people that we already have. And there's a cost to that. We have to recognize that. So that's number one on my list. Oh, thank you. Appreciate your support.
Any other questions from council members? Okay, seeing none, then we will go ahead. Thank you, Director.
Thank you.
Appreciate
Appreciate
that
the
you're
time.
here. I want to acknowledge that we do have two very reputable letters here in your support from Hennepin County and the Department of Homeland Security. So kudos to you for getting that support, and feel free to take a spot. We will go ahead and move this reappointment by the Executive Committee and move it forward. So all those in approval, please say aye. Aye. All those against, please say nay. That item moves forward. So that wraps up our public hearing, and now we are moving down to our discussion items on the agenda, with item number 1 being the 2017 fourth quarter body-worn camera metrics and report. Thank you. Please feel free to introduce yourself to the committee, and we will get started.
Okay, council members, good afternoon. Commander Chris Granger from Minneapolis Police Department. And I'm going to be presenting our fourth quarter body-worn camera metrics. I'd like to cover 4 items for the presentation today. The first one is a brief preview of our new revised body-worn camera policy. The second is the status of our 2 civilian body-worn camera auditors. The third is some metrics, some department-wide metrics, and then also some metrics from a random sample that we conducted of 25 officers who are currently using body-worn cameras. And then lastly, I'd like to give you a preview of some of the dashboards that we're building to track metrics moving forward. First off, the new revised body-worn camera policy. The policy currently is being reviewed by stakeholders. The PCOC, the City and Hennepin County Attorney's Office, the Police Federation, our appointed staff, the Internal Affairs, Quality Assurance, Business Technology, and the training units. And it also includes a review of best practices. We anticipate the policy will be implemented by the end of the month. Some highlights from the policy, or some proposed changes rather. SWAT officers will be required to wear body-worn cameras with few exceptions that will be directed by the SWAT commander. Officers will be required to keep their body-worn cameras powered on at all times during their shift. Officers will be required to provide the case number for related videos in the proper format, and I'll talk more about why that's important later to us. Officers with body-worn camera equipment issues, such as missing, damaged, or malfunctioning equipment, must note this in any reports made that their body-worn camera was not operational for the associated reasons of continuing in service. And lastly, any in-person contact at the precinct desk that involves a report of criminal activity or a complaint of misconduct will require body-worn camera operation.
Mr. Granger, if I could, I'm going to be asking a question, but council members, if you have questions too, please chime in on the speaker management, or I'll try to keep my eyes on your tabletops. So I do have a question about the powering on versus activation. So I was reading the draft document, and so can you just explain the difference between having your equipment powered on versus the activation, and how that relates to police officers going to community meetings? Because I saw a note there that if they go to community meetings, it's required to be powered on but not activated, I believe is kind of the direction. So if you could just tell us, what does it mean when something is powered on, and what does it mean when it's actually activated?
Absolutely. So what the new policy is going to require is that the cameras are kept powered on throughout their shift. And what that means is the camera is ready to be activated at a moment's notice. What it also means is that there is a pre-event recording. It records in 30-second segments, so that when the camera is operated, you actually have the recording itself after it's activated, plus the 30 seconds of video that was recorded beforehand. So that would capture anything that happened prior to manual operation by pressing the button on the body-worn camera. As far as community meetings, for example, go, activation isn't required for something like that. So essentially the officer would just have the camera on. It's recording that 30-second buffer, which just recycles over and over again. It records 30 seconds, and then the next 30 seconds overwrites that. And that process continues until you actually activate the camera.
I'm just curious. So then in a normal shift for a police officer, from the moment the camera is powered on until the shift is done, is there enough battery life to cover that shift? Or
There is.
There is.
Yes.
Okay. Wonderful. Okay, please go ahead
Okay.
with your presentation.
The second item are two civilian auditors. One of our auditors has begun work, which started on March 5th. She's in the process of completing some training. Some of the areas that she'll be focusing on is learning her way around evidence.com, working with our visualization software, familiarizing herself with some of our policies and procedures, and also the procedures for conducting body-worn camera audits and reporting. And during this process of training, and they'll also be doing some work in there too, I'll also be receiving assistance from other MPD units to continue our work in conducting body-worn camera audits. The third item, 2017 fourth quarter body-worn camera metrics. So with this slide here, I wanted to give you a snapshot of the overall activity of the MPD, how many videos we generate in a month, and then an average of how many videos we generate per day. In October, we averaged about 1,666 videos per day. In November, an average of 1,506 videos per day. And then in December, an average of 1,400 videos per day. The next piece of our metrics study was we took a random sample of total of 25 officers representing all 5 precincts. And these were officers that respond to 911 calls, and also they were officers that were equipped with body-worn cameras from October 1st through December 31st. And then from there, we took a random sample of 10 body-worn camera videos from each officer, and then looked at these metrics. The first one was there a full 30-second pre-event recording? The second was, did deactivation at the conclusion of the call appear to be appropriate? The third was there a proper case number entered? And I'll get into later why that's important. And then also, was there a category entered for the recording? And here are the results that we found from that audit. We found that 24% we looked at a total of 248 videos. 2 of those, I believe, one was photos, and that was pulled in error in the sample. And then I believe the other one was a startup video. But out of the 248 videos that were reviewed, 24% of those cases did not have a proper case number. 5% of those cases, there was no category listed for the recording. And then in 14% of those cases, there was no 30-second pre-event recording. And then in 7% of those cases, it did not appear that deactivation occurred properly at the conclusion of the event, or the reason was inconclusive. So some of the patterns that we observed in this random sample, some of the videos had no pre-event recording. Others had pre-event recordings in durations of 2 to 3 seconds. And how that occurs is the camera is powered off, and then it's powered back on. And then the time between when the camera is powered on to activation determines how long in duration that pre-event recording is going to be. That's why we saw that variance. Some videos had no case numbers or improperly entered or incomplete case numbers. Some officers were improperly turning off their body-worn cameras when the scene was code 4 or stabilized, but before the conclusion of the call. In some instances, the body-worn camera lens appeared to be covered during the pre-event recording, possibly by clothing such as a jacket. During one call, an officer failed to turn their camera back on after speaking with their partner. And then in some instances, it was not clear why the officer turned off their camera before the conclusion of the call. And here's our last item. So the other thing I wanted to do today was to sort of give you a preview of where we're going, the dashboards that we're building to track metrics for every body-worn camera user on the MPD. So our goal is two goals is to utilize visualization software to efficiently and accurately track quantitative metrics for every body-worn camera user that are updated daily and accessible by MPD supervisory staff through a dashboard. And then also to increase our capacity to conduct regular qualitative reviews of body-worn cameras to ensure policy compliance and to identify and address performance and training issues. How this began, a data connection was built by City IT along with Axon so that we could receive body-worn camera data from the evidence.com platform to track quantitative metrics. This work began in May of 2017. Evidence.com data can now be compared with data from CAD, our computer-aided dispatch system, using visualization software. We're currently building a process to incorporate timekeeping data into the tracking process. So one of the things that we'd like to know is, for example, if a person is working overtime and it's 911 call shift coverage, we'd like to be able to determine when there should have been a startup for a body-worn camera usage that day and when there wasn't one required. Okay, a couple of issues that we saw or that we're seeing now, two issues. We're seeing uncategorized and improperly categorized videos. For example, if a body-worn camera video for an arrest is incorrectly categorized as non-evidence, this evidence could be lost in the deletion process prematurely, as opposed to a video being categorized for an arrest would be captured for 7 years as opposed to 1 year for non-evidence. Also important to accurately measure electronically whether startup checks are occurring. For example, the body-worn camera videos have to be categorized as a startup. Otherwise, the data can give the impression that the checks aren't occurring, and we saw this. Or at least we saw indications of this where a person, we'd run a startup report and we would see the officer had maybe 2 or 3 startups for the month, but then we'd also run a total video report and notice that there are multiple videos that weren't categorized as startups. So what that means is when we see that is we have to do a manual examination, which is very resource and time consuming, to actually figure out what the videos are, if they're arrest evidence or if they're startups. The second issue is we're still seeing missing and incorrectly entered case numbers for videos, and that makes it difficult to connect videos in evidence.com to CAD incidents so we can do a proper count. Without this information, again, a manual examination is required to get accurate counts of videos created for each CAD event by each body-worn camera user, which is, again, resource and time consuming. Right now, approximately 30% of all the body-worn camera videos in the system have no case number or an invalid case number. It's missing the year, for example, or an improperly formatted case number. So I'm going to show you some graphs here in a second. What I did was I took the dashboard that we're developing and I took some snapshots to show you what we're seeing preliminarily in the data. The following graphs represent the percentage of officers who were equipped with a body-worn camera and responded to a CAD incident that required activation. Most of the CAD events that do not require activation were excluded in the data. For example, business checks, direct patrol, footbeats, community meetings. On July 26th, and I want to highlight this too because you'll see that the impact of this in the data. On July 26th in 2017, a revision of the body-worn camera policy was implemented and appeared to have a significant impact on body-worn camera usage. The approximate 30% of body-worn camera videos in the system that have an improper or no case number could not be matched electronically to the CAD event and therefore were not counted in the data compiled for the following graphs. So just to give you an idea of where we're at in February of this year, we're still 28% of the videos had an improper or no case number. And then lastly, once case numbers are accurately and consistently entered for every video, we will have more clear data and expect that body-worn camera usage percentages in the following graphs, we expect those percentages to increase. And the reason for that is we have 30% of all these videos. We're not sure what events they're related to, but they are videos. So some of them could be startups and the rest of them are probably CAD events or training events or something like that. So we do expect these percentages to rise. So here's the first graph represents, this is an overall view of CAD events, subtracting community meetings and footbeats and things like that. And essentially it represents performance data from January of 2017 to February of 2018. So in June 2017, the numbers were at 18%, and then you had the policy implementation, and then the number jumped to 61% in August of 2017, and then In February, it was at 55%. And again, what's important to note here is that this does not include, because we're unable at this time to electronically match videos that don't have case numbers to CAD events. So we're missing 30%. So if you were to factor some portion of that in here, this percentage would probably rise. I'm confident of that. The next slide, I wanted to give you sort of a snapshot of a few of our CAD calls and our performance related to them. The next one is our traffic law enforcement and officers equipped with body-worn cameras. Again, in June of 2017, before the policy change, 46%. After the policy change, 69%. And as of February, we're at 70%. And again, if you factor in that 30% of missing cases, that number is probably going to rise again. I can't tell you exactly to what percentage, but there's lots of video. And again, in order for us to determine that, we'd have to manually look at all those videos to figure out what they are. The second another kind of call is a suspicious person call. And the percentages here, we're at 57% as of February. Again, and this was a huge increase from June of 2017. And then lastly, unknown trouble calls and officers equipped with body-worn cameras. June 2017, 12%, and today we're at 49%. Next steps. So the findings of this audit will be provided to precinct commanders as soon as possible so that they can take action to improve on compliance. Quality assurance has already been providing feedback to precinct inspectors on body-worn camera usage, concerns regarding their personnel. There are prepackaged training aids that supervisors and officers already have access to for retraining purposes. Quality assurance is working to increase our capacity to provide accurate and more timely data to supervisory staff, such as weekly and eventually daily updates on body-worn camera usage, so issues can be addressed as soon as possible. We expect the implementation of the next policy revision, along with regular audit results being provided to supervisory staff, along with follow-up, to ensure that appropriate actions are taken, will have a significant impact on improving compliance. And then roll call training, when the new policy revision is implemented, will be conducted throughout the department. Also, we're going to continue refining our dashboards and making sure that the data accurately reflects what it's supposed to. In some of our earlier iterations of the dashboards, we had situations where we had more videos than CAD events, which made performance look better than it was. But then we took into account, so for example, there are some calls where there might be 3 videos on that call, and we wanted to account for that and turn those 3 videos into credit for 1 video per CAD incident. So we're going to continue refining our dashboards so we can track individual metrics. And then also as part of that effort, where we're going is we want to build dashboards for each shift in the city. So ideally, a supervisor could come in the morning, sign on to their dashboard, and they can see the activity of their officers from last night, day before. And that can happen on a daily basis. Next week, we're meeting with Axon's product team to discuss compliance solutions. And that would include products that they have currently under development. We're also going to be specifically discussing a solution for applying a fixed format for entering case numbers. And then also, we're also curious about some of the solutions that they are already using for other departments. We'll continue research on best practices for compliance tracking. That would include the DOJ's body-worn camera training and technical assistance program, along with looking at other police departments tracking compliance and developing tools. We'll also be developing an interactive dashboard with body-worn camera metrics that will be accessible to the public this year.
Thank you so much, Mr. Granger. I have a couple of questions on this draft document that I was reviewing earlier today, and I appreciate knowing that there's a number of groups that are very important to this conversation that are vetting the draft policy. So there's a point here on page 3 about the quality assurance unit. as responsible for the oversight of the program and ensuring policy adherence. I was just curious, how does that happen? What is the process to ensure policy adherence? Are we doing, like monthly check-ins with specific groups, or is it kind of like, somebody raises their hand and says, oh, we have a question about, following this procedure? What's kind of the regular check-in process to ensure that the quality assurance unit is able to pick up any lack of policy compliance and then can help bring them into the fold?
Well, generally speaking, we would find a lack of policy compliance maybe in a study we would do or an audit if that were requested, or if it's something that came to our attention that we thought we needed to address. We might also find issues in a project improvement process where we see issues that we see sort of a policy that needs to be updated, or we see gaps in a procedure. So we would find issues that way. That's generally how we would be addressing things like that, is primarily through projects and audits.
All righty. Thank you. And we have here a question from Councilmember Fletcher.
Thank you, Madam Chair, and thank you, Commander Granger, for that presentation. I appreciate it. I have a comment first and then a couple of questions. And my comment is just that it's a little frustrating that we didn't see this sooner, especially if that data pipeline from the body camera service to us was being developed from June 2017, why we didn't know about it when we were asking, aren't there other ways to measure this? Aren't there other ways to present this data a month ago? I would have appreciated hearing about that and knowing about it at that time, because it seems like actually, I mean, in many ways, this got presented as sort of a conflict between this committee and the police department, where you guys were presented as really not presenting data that we were asking you for, and it feels now in retrospect like kind of a self-inflicted wound, right? Like that we ended up, you have this data that this is something you've been working on, and that somehow the right hand didn't know what the left was doing. And so I'm happy now to see that we're starting to get some of this data. I think that a 2% sample to confirm what we're seeing in this broader data makes a lot of sense to me as a sensible way to measure this and to audit this to look for compliance moving forward. But I just want to express a little bit of frustration that we didn't have a complete sense of this. I am glad to see it now. So then the two questions that I think arise out of your presentation for me, the two things that I'd like clarification on are, one, you mentioned calls where there might be 3 different videos, meaning they turned off the camera on 2 occasions during a call. And it's hard for me to imagine what the circumstances are that would be appropriate. So I guess I want to find out why we're turning off cameras during a call. Can you talk me through sort of the moments of procedure where that's happening and why we would be okay with that? Because it feels like we might miss critical information if we're mid-call and turning off the camera for some reason. And then my other question is that there was a pretty marked trend from October to November to December of the number of activations going down. And I wonder if you have a theory about why that's happening.
Okay, so to speak to your first question, Councilmember Fletcher, for me to explain to you why that's happening, I mean, I'd have to look at some of the videos myself to determine what patterns are emerging. I can tell you that anecdotally from things that I've heard is, for example, a supervisor on a call might turn their camera off. They might be dealing with an officer and a person from the public, and then they might turn their camera off for a phone call to the medical examiner's office. And then once that phone call is complete, then the camera is turned back on when the interaction between the officers and the public resumes. So that might be one instance of that. And then another instance might be, partners away from their interaction with the public may be discussing, some decisions that they're making about how to handle a call or something of that nature. And then once the interaction between the public resumes, the camera is turned back on. I can tell you my impression historically of this instance is that the policy, folks had expressed interest to me that the policy may not have been clear enough as to when those instances when you could turn it off and turn it back on. There was guidance that was listed, but more guidance seem like maybe it might be helpful. So officers would know that, they have to keep the camera on in this instance, or they don't have to have it on in that instance.
And do you feel like there is sort of clear and sufficient policy about when it's appropriate to turn a body camera off under what circumstances, and that we have a way of checking whether that actually occurred?
So the policy is in draft form right now. So there's still discussions going on about the different parts of that policy. And I haven't been part of all of the feedback that's been given from all the other groups. So I don't know exactly how that's going to look in the end. And then to answer your question about if I have, I think you asked if I had a theory about why the trend seems to be going down. I can't explain that. I can simply tell you that we have some work to do as far as improving compliance, and we have a clear path going forward as far as auditing and tracking metrics, and then being responsive within the department to address those deficiencies. I can tell you that.
Thank you. And now we have a question from Councilmember Palmisano.
Thank you, Madam Chair. A few comments and questions, if that's all right. Could you go back to slide 6? Slide 6 is back.
Is it this? Oh,
That,
there we go.
the number of videos recorded, there's a lot of difficulty in using that as a measurement. For example, officers might go on 3 calls before deactivating their video, their camera. So that could be a measurement of error. It could also be an error in officers turning on and off their cameras multiple times during one event. But I do want to point out, just because it's not represented on the slide, that back during the audit last fall, we found that before the policy change to have cameras on at dispatch, there were roughly between 500 and 1,000 videos per day being captured. And immediately after that policy change that Chief Arredondo initiated, what we saw was between 1,500 and 2,100 videos being captured a day. That's pretty consistent with these metrics that you're showing. And I think what I like to think that shows is that a policy change can have a pretty substantial and fairly immediate impact on things. Just because videos isn't always the best metric to use, I did want to give that context to my colleagues in the public. Could we go to slide 7? Or actually, I'm sorry, slide number 8. Another piece of this in this sample size and in looking at these videos that I think shows improvement. One is the no complete 30-second pre-recording. The idea that these cameras don't have enough battery life is a huge myth that was brought up, and it just doesn't pan out. But there are other potential reasons why not having your camera always running kind of latent is what I call it, that wouldn't happen. But I do want to show that there's been some small improvement in that. I don't remember the exact figures or the way we were measuring it last fall, but this metric shows some small improvement. The piece that actually does show more substantial improvement is and this is a double negative, but the proper deactivation at conclusion of event. Last fall in our audit, it appeared that 22% in the pre-policy change era had deactivated their camera before the conclusion of an event. And after the policy change in August, I think, the policy change to have cameras on at activation, it fell to 12%. So now getting to 7% does show improvement in this kind of sample size. I want to also point out that in these metrics, you're not seeing an apples to apples comparison here. from the way that that audit was conducted last fall, those numbers look very different. And part of it is because of the way they're joining the data, and that error margin of that 30% that is a basket of kind of unknowns. So there isn't really an apples to apples comparison here in this information today, but I am curious that until this case number entered properly, rate, until that gets really part of the regular workings of the body camera program in these small sample sizes, because you are watching that video anyway for those 25 officers, could you see and examine what percentage of CAD dispatch events that should have a video have one? Could the public get that information in an ongoing way for this sample size?
So are you talking about going forward with the dashboard we're going to create?
Yeah.
Yes. So a metric like that would be possible to show how many CAD events versus officers who responded to those with body worn cameras. Yes, we could provide a metric like that. It's possible.
I appreciate that, because you're already watching them for these other attributes
Correct.
that you mentioned. So to me, it would take 10 more minutes. You're already watching all of these videos for these other attributes in this 25 officer sample size. I guess the broader question here is, how will MPD use this data to improve the program? Both the fourth quarter aggregate data that we're seeing here, and thank you very much for doing that, but also the qualitative data. How can you share with us here what you plan on doing with that will help improve this program?
Absolutely. Well, first, let me start by saying that the data indicates that policy revisions are effective, in improving compliance. So the policy revision, I think, is half of the equation. The other half of the equation is getting performance data into the hands of supervisors in a timely manner, so they can use that data to either retrain or to ensure that compliance is occurring at the individual officer level. So, for example, during this process, if we find someone who is lacking case numbers or categories, what we could do is, and what we do with this generally and specifically, is get that information to the precinct commander and ultimately to the shift supervisor, who would then be able to look at the report and specifically say, you went to 10 calls yesterday and only 5 of those calls have body-worn camera videos, when really all 10 of those calls required activation. That's something that they can address right away, either in a mentoring kind of situation or in, a worst case scenario, maybe a progressive discipline kind of situation. Does that answer your question?
It does. It also, I think, shows that we can be more, with these dashboards, we can be more transparent to the public, and we can use them really effectively because you can get individualized reports off of it. So thank you.
The only thing I would add as far as public dashboards go, though, is, what we wouldn't want to do is we wouldn't want to publish individual performance data. That's the only caveat I'd add to that.
But you can use that individual data on a supervisory.
Correct.
In a supervisory way.
Councilmember Fletcher.
Thank you, Madam Chair. I just have one more question, which is I'm wondering, the 30% noncompliance with proper case numbers seems really, really high. And that seems to indicate that there's a programmatic problem, right? Like usually if something like that isn't working, that seems like a problem with the software or the hardware, or something's not happening right. And we're going to get continually frustrated with sort of speculating that the data matches up pretty well if you account for those case numbers that aren't getting recorded, right? So what are we doing to fix that? Why is it so hard to enter right now?
Well, first of all, it's very important to this process, so it is a high priority. What we're doing to fix that is, so with the revised policy that's coming out, it's going to be required. It hasn't been required up until this point. It's part of policy. So that's the first thing. The second thing is we're also working with Axon in our meeting next week to talk about what we'd like to do is we'd like to fix that box where you enter the case number. We'd like to fix the format so you can't move further in the process without entering the year, the dash, and the 6-digit number. And if we're able to do that, that's between the policy and that fix, I think we're in pretty good shape as far as compliance goes. If we're unable to do the fixed with Axon for whatever reason, I still think the policy is going to be effective along with our auditing efforts as well too. Timely identification of this issue, communicating that to the supervisor so that they can take action to correct it is going to be also important.
Okay, thank you.
All righty. Any more questions? Well, Commander Granger, thank you very much for this presentation. We will be following up with you in the lead up to the final approval of this draft policy. And I know that MPD will be visiting our committee quarterly to give us updates on the body-worn camera program. So thank you so much. And without further questions, then I will go ahead and receive and file this report. All those in approval, please say aye. Aye. And that will move forward. So now, given that we have our chief of police here joining us in the room, we are actually going to just bump up one more presentation, which is the Narcan naloxone pilot project update. And then we will resume with our order with the Police Conduct Oversight Commission, and then the Commercial Sexual Exploitation Work Summary, as well as the City Attorney's Criminal Justice Reform Initiatives. So let's go ahead and hear a report on that, and please kick it off, Chief.
Good afternoon, Chair Cano, committee members. Thank you for having me here this afternoon. Opioid heroin use and its impact on our communities has been something that I know that all of you have really been voicing for quite some time, and the harm and impact that it's had on our communities. We looked at exploring having our officers carry Narcan, Naxalon to help our community members that may be in distress from these opioids out there in our community. And so with that, we launched a training initiative that we would actually look at a pilot project. Of course, I like to say a very temporary pilot project because the need is great enough that we need to make sure that all of our officers are out there carrying Narcan. The first week in April, we will have approximately 120 plus members of our department who will be utilizing Narcan. They will all go through a 4-hour training, and then they will be given the Narcan drug. The focus originally was, even though it is a citywide problem, we did see some challenges within our 3rd precinct. So we do have footbeat officers and 3rd precinct CERT team officers that will be carrying this. However, we are making sure that all of our citywide CERT teams from all the 5 precincts will have this. Members of our weapons unit, we will also have those folks within our organization that have a propensity to come into those with the drugs and fentanyl and carfentanil, which is very dangerous. Our folks that gather evidence at scenes, they will be also outfitted with this. The goal for me is to make sure that our entire department is carrying Narcan by year's end. But we will try to be as aggressive as we can to make sure that we can start rolling it out for our folks throughout the year. And so that has been the goal, and I will certainly, Chair and committee members, report back through our quarterly meetings to let you know our progress on, with the goal of ultimately making sure that all of our responders have Narcan to help our community.
Thank you, Chief. This is the time for questions, if committee members have questions. If speaker management isn't being updated, then you can just use your little tabletop name tag. I'll go ahead and ask a question. Okay, we have one question from Councilmember Cunningham. Not one, but Councilmember Cunningham. Go ahead. Go ahead.
Thank you, Madam Chair. Thank you, Chief, for this. I was just curious, particularly in the 4th precinct, would you say that when overdose calls are made, would you say that the fire department or the police department typically makes it to the scene first?
Chair Councilmember Cunningham, it really can, well, so if a call is made, that is usually going to be dispatched through MECC, or Minneapolis Emergency Communication Center, to our fire folks. And so They receive a bulk of those. But I do know that the concern from our elected officials has been that we will have officers who are either walking a beat, it could be our CERT teams responding to a call, someone's down, having an OD. So there's also that need that we have an impact as well by being sometimes the first ones on the scene. But fire continues to get a bulk of those calls. I think one of the conversations that prompted, I know, Chair Cano over a year ago was that fire almost doubled their amount of overdose calls. And Chief Frito was very concerned about that. So the conversation was if we can equip our folks with it, we might be at the scene a little bit quicker sometimes. Yeah.
And would you say that fire or the ambulance typically respond first?
Chair Cano to Councilmember Cunningham, depending on the nature of the call and how it's dispatched, they will sometimes send fire and a rescue rig. So whether it's HCMC ambulance or North Memorial, you'll sometimes get, and oftentimes it's who gets there first. Mm-hmm. The great thing is that we are a city that is very fortunate to have two really good trauma centers on each end of the city. So if fire doesn't get there right away, usually we've got one of those rescue ambulance rigs there. But again, because of the volume of these types of calls that are plaguing our city, we really wanted to make sure that our police officers, our first responders had the drug as well.
Great. Thank you so much, Chief.
Yes.
Councilmember Jenkins.
Thank you, Chair Cano and Chief. My question is very similar. So I guess I'm wondering how often are police officers the first contact for overdoses? And then what's the training for delivering Narcan?
Chair Cano, Council Vice President Jenkins. So we have just really seen the amount of overdoses in our city has just really skyrocketed. Mm-hmm. Where we had typically seen, and we still see community members who will call 911 when they see someone experiencing an overdose. We have also, quite frankly, seen our officers coming across these, whether they're walking the beats, whether they're conducting a search warrant at a house. They're there. They're the first ones there. And in some cases, the amount of heroin opioid addiction in our community got to a point where we've actually seen people who have overdosed and literally had a sign taped to their shirt saying, "The Narcan's in my pocket." I mean, that's how serious this has been. So we wanted to make sure that without a doubt, the more that we can equip our men and women who are out there with carrying Narcan, if they happen to be the first ones to come across this, we want to make sure that they have that available. To your question about the training, Council Vice President Jenkins, I'm not exactly sure how the training is conducted, but I do know that it requires through Hennepin County EMS, they help our person conduct the training. It's required 4 hours. I do know that, or I've heard that there are some in the community that get less of a training, but there are some parameters that are set that we just have to make sure it's 4 hours for our folks. But once that training is completed, they'll be distributed to Narcan, and then their individual teams and units can go out there, and at least they have that. There's also some specifications about, how you store the Narcan, and so we had to make sure that we had all those measures in place to make sure that we're in compliance with that.
Does it need to be refrigerated or?
Chair Connell, Council Vice President Jenkins, that I don't know. I just know that there's some medical compliance procedures, and so we made sure that our lead trainer is working with Hennepin EMS to make sure that we're in compliance with that. Maybe that's a great question. I don't know.
Thank you, Chief.
Yes.
Thank you, Chief. And I do realize that there's a staff member here from, I believe, MPD, right, who's are you working to roll out the pilot project in the 3rd precinct? I just wanted to get a sense of your role and if you could talk about any additional details that you could share to what the chief has laid out for us. I just saw you from the back.
Chair,
like, oh, wait.
committee members, you set me up here. Here's the expert here. He can he'll probably refute everything I just said. But
so, perfect job, Chief. Thank you. Madam Chair, council members. Sergeant Hillbo with Minneapolis Police. Let's pull my PowerPoint real quick here. So, like the chief just said, rolling out the pilot program for MPD. Basically, a real quick agenda that I'm going to have for everybody. I don't have it on the PowerPoint, but just basically some overdose facts involving opioids in the United States, as well as our pilot program, which we probably skip because the chief did an excellent job of taking care of that. And then basically who's going to do the training, which would be myself. And then we have actually another paramedic on our department that was working with North Memorial. And we have some different training aspects I'm going to talk about and how I'm going to train those officers in those 4 hours that we'll have. And then I'll even show you what we have for a Narcan kit and how we're going to store it and where it needs to be stored. And if you want to know, I can tell you how we're going to apply it to people when we do come across them. So we also have some policy information for you, as well as state law on officers carrying it and the training required to have, and then as well as the Good Samaritan law that is out there. Sorry. Is that better? Okay. All right. So real quick, actually, it's much louder now, isn't it? So talk about some opioid drugs that are out there right now. So what we're kind of seeing around the country is a greater increase in a lot of the drugs that are in front of you. There's some morphine, Vicodin, Oxy, all going down to heroin, carfentanil, fentanyl, and a lot of these things are becoming a much greater, much more, just seeing much more out there right now in the country. So we're seeing an explosion of these. So some of the statistics that are going on in the country, the leading causes of deaths around the U.S. in the last couple of years, some of these big ones, obviously, suicides and deaths from AIDS, casualties in Vietnam, all very significant in those years. Those are the highest causes of death. But then look at 2 years ago in 2016, 64,000 people in the United States died of drug overdoses. A large cause of that was from heroin and fentanyl, and seeing a big spike in those fatalities in the last couple of years. Look at some of our big prominent singers that we love in this country, Prince and Tom Petty. How did they die? From opioid overdoses, as it turns out. So, and both of them involve fentanyl. So I think the chief did a really good job of talking about our pilot program and how we're going to get into the 125 officers into that training. We have a medical director now for the City of Minneapolis Police Department. Some of the things we'll be doing in those 4 hours, basically we're going over a lot of things I just talked about, the statistics, the pharmacology, and how Narcan or naloxone, it's the same thing, how that works, how we're going to document our uses, still going over our policy, and I'm talking about state laws and basically the requirements, as well as just doing skill stations on basically breathing for somebody. It's one of the big components, making sure we recognize an opioid overdose, so it's the decreased respiratory aspect of somebody, as well as pinpoint pupils and possibly even unconsciousness. And then we actually go through a couple scenarios too to get them warmed up. So our medical director and our trainers, as I talked about, it's going to be Dr. Paul Nystrom. He was not able to come here today. He was actually working over at HCMC. But he is the assistant medical director over at HCMC for their emergency department. You have myself. I have been with Minneapolis for 20 years, and then I've been a paramedic for 8 years. And then we have Officer Dan Diepenbrock. He's a newer officer, but he has about 9 years with North Memorial as a paramedic as well. So very experienced people that have given Narcan and naloxone and practiced medicine for quite a while. So our overdose kits, might be hard to see, but this is the live view, and officers can carry this in their pocket. Real simple. I believe one of the council members asked Chief about if there's any considerations on how it needs to be stored. Just room temperature. So it is temperature compliant, so it needs to stay generally in that area. It gets too hot or it freezes, it actually can lose its potency. It has a 2-year shelf life. And officers just need to have retraining on this every 2 years, basically based on state law. So we get into state law, and basically all it really says is for someone to be carrying Narcan, specifically police officers, you need to have a medical director, you need to have training on it. And then we get into the Good Samaritan overdose prevention law, and specifically says that someone that has Narcan and they are trained and they have it, they're allowed to use that on somebody that is going through an overdose incident. So that's about all I have. Just this last slide is just basically the amount of heroin, fentanyl, carfentanil that would be able to kill somebody, the lethal dose. So we're seeing just a big increase in a lot of this stuff. A lot of it's coming out of the East Coast. It's coming our way. Any questions, Madam Chair?
Did you have more questions, Councilmember Jenkins, or was that? Okay. I do have, so just to clarify, Sergeant Hilbo, what is the date that the pilot program will be active?
So pilot program, we are rolling it out. It's going to be the first week of April, April 2nd to 6th. I'll be doing 125 officers during that time period.
Mm-hmm.
So after that, I think we have a lot of training going on with our new computer system. And so it might happen, get everybody done maybe a week after that, just to comply with some units that might have training going on that week. But for the most part, it'll be done the very first week of April.
So by the first week in April, we can expect officers in the 3rd precinct to be carrying the little tool you just showed us.
Yes, ma'am.
Okay. And what are some of the metrics that you're hoping to keep track of long-term to figure out how the program is being used by MPD in supporting our residents?
So basically, Madam Chair, I have a documentation sheet that all officers are going to carry inside this. And when they do administer Narcan, obviously they'll be using up their dose. They need to contact me to get a new vial, as well as submitting that documentation. I'm going to keep track of all statistics involved in the use of the Narcan for Minneapolis police officers.
Mm-hmm. Does your training module help officers understand that bystanders can administer Narcan or naloxone if they're in a situation where somebody needs it and the officer may not have it? Because there was a small report that came to me about a situation where a bystander wanted to administer the Narcan, but the MPD officer wouldn't allow it. I'm trying to get more details on that. But just in the case that we see that again, I just want to make sure that our officers are getting a message about being able to support those bystanders in a situation like that.
I'm sure. So for that situation, I wasn't completely aware of how that happened or where it happened. But in response to that, what we're doing is we do an information push, administrative announcement to all of our officers, I believe within the next week or two. I was just told that this morning by our commander, and that was from our, I believe, Deputy Chief Force, in order to get this information to all our officers. So ones that don't go through this training, obviously, my officers that are going through, the 125 pilot officers, they'll have this information. They'll understand the Good Samaritan law. But then the rest of the officers in the police department will get that information as well about the Good Samaritan law. So if that does happen, they will be aware that, yes, they can allow that person to assist them.
Mm-hmm. Okay. And I had one more question. I just kind of, okay. Thank you. I appreciate, oh, actually, yeah. Could you open up the little kit and just show us what it looks like on the inside?
So inside, rubber gloves, as well as the documentation sheet. And then this is my training one, so I keep showing everybody. This is basically a nasal applicator, so it's an atomizer. So basically it turns this into a spray.
Mm.
Of course, it won't come out now. And so all it is the naloxone, and I'll have to assemble it inside here, put that nasal atomizer on, stick it in the nose, squeeze half of it, the dose, and also outfit our officers with, it's called a BVM, a bag valve mask, which basically allows them to breathe for the person while this is getting set up.
Mhm.
That's kind of one of the biggest things too, is that with opioids, what happens is that your respirations decrease to the point where your body can't perfuse anymore. And that's generally what causes death.
Councilmember Jenkins.
Thank you, Madam Chair. Yeah, I do have a couple of questions. So, what is the cost of the kit, and do we have an estimate to supply the entire force with this treatment or therapy? And what happens when, is there a policy about when we do save a person's life? Like, what is going on afterwards? Do we just administer the Narcan and they get to go home, or how? What do we have a policy for after care, or we thought about that?
Yes. Madam Chair, Councilmember Jenkins. So to answer the last one, part of the policy that I submitted to be reviewed is that the way opioids work is that it's spiking in the body, and what happens when we give the Narcan, it blocks the receptors, it lowers that response to that drug, and so you get the person back. However, Narcan, naloxone, it only works for so long. It has a short half-life, and so after that wears off, the opioid will begin to take over those receptors, and you begin to have that overdose again. So part of the policy is that it's going to be a shall. Officers will have HCMC or North Memorial transport to the hospital. So we'll be taking them to the higher level of care. We don't want them just to leave and re-injure themselves or possibly die from that overdose because the naloxone wore off. So back to your first question. The cost for the naloxone is approximately $50 per vial. I believe that with a higher amount that we buy, obviously the cost will decrease. I wasn't aware that we were doing the whole department. I envisioned that we were going to do that, but I have not gotten the full amount of how much that would cost for every officer to be carrying that just yet.
Do we know, is that grant subsidized, or is that coming out of the department's general budget?
It's coming out of the budget, and I've been researching grants for this type of thing. I know there is statewide grants and federal grants that are out there for this.
Yeah, I guess the last question that you answered, which is great, so they do get medical attention after the Narcan is administered. Do we know, is there any intervention to help people get to treatment, to get to some, the way those drugs work, you need more and more. So if you're gonna continue to use, the likelihood of overdosing is greater than the last time you overdose. So I'm just curious what happens after people go to the hospital, or do we know what happens when people go to the hospital?
Madam Chair, Councilmember Jenkins. So I know HCMC does have advocacy programs for drug addicts, and there are individuals that help over there. I know there's those types of avenues that they can go and get can seek help. That's about the best I know for that.
When Narcan is administered, is there, I guess, depending on whatever criminal activity may or may not be happening, is there any records or data around arrest in those situations where people are in need of Narcan? There, you come to the scene. What's the I guess, incidents of crime happening at that scene? Do we know?
I don't have that kind of data.
All righty. So, I mean, it's great that we're helping to save people's lives, but it just seems like there's a lot more that goes on in those situations. That,
Correct.
yeah. Thank you. Thank you so much.
Thank you.
Thank you, Sergeant Hilbo. I appreciate you coming to present to us today. I learned a lot about this issue. Councilmember Andrea Jenkins's questions are right on, and that's one of the reasons why our mayor has decided to launch this multi-jurisdictional task force to address the opioid abuse in the community. So a lot of those questions that you just shared, I've been able to send over to our staff to look at for the internal meeting we have on this task force. And for MPD, I believe that our residents are really looking forward to ensuring that no one life is lost to this very preventable situation, where if MPD is there with their Narcan administering capabilities, we don't have to be the ones to get the call saying, only if you had done this, we could have this person alive today. So it's all hands on deck. Every life matters. And I really appreciated the chief being here this afternoon, letting us know that MPD does have a goal to have all of their officers equipped and trained by the end of the year. I was hoping to do a staff direction today to ask that it be done by June 1st, but then he explained to me that a 4-hour training for all those individuals would take a little bit more time. But he did assure me that this is a very serious matter for him and that he is doing all he can to ensure that our entire department will be equipped by the end of this year. So I look forward to hearing about how the 3rd Precinct pilot project goes, and we will be inviting you to come back probably at the end of the summer to let us know how things are evolving there. And we will continue to work on the opioid task force that's going to engage other partners, safety partners across the region, to figure out ways that we can work together to have more synergy in addressing this issue and really eradicating the opioid abuse that's really sweeping our city right now. So appreciate it. Thank you so much. So without further questions, just double check here, we will go ahead and approve, receive and file this report on the naloxone pilot project update. So thank you very much. All those in favor, please say aye. Aye. And our next item then is the Police Conduct Oversight Commission overview. So if we could have our staff member please join us and introduce herself. Thank you so much, everyone, for your patience.
Good afternoon, Chair Cano, Vice Chair Fletcher, Council Vice President Jenkins, and council members. My name is Imani Jafar. I'm the Director of the Office of Police Conduct Review, along with my legal analyst, Ryan Patrick, and the Acting Chair of the Police Conduct Oversight Commission, Andrea Brown, who's joining me. We are going to do a very brief presentation on what the Police Conduct Oversight Commission does and hopefully how we can work with you. So to start, right now, the Police Conduct Oversight Commission has 7 members. Councilmember Palmisano actually authored an amendment that helped expand some of the work that the Police Conduct Oversight Commission does, as well as the Office of Police Conduct Review. And one of those changes was to make it a minimum of 7 members. They do a lot of work for 7 people, so we're hoping within the next appointment cycle in the fall that we will be able to get a few more members to join them in the work that they do. Everybody on the commission is required to be a city resident. The process they go through is the boards and commission process that goes through the clerk's office. We do look for ward diversity. You're welcome to help in recruitment efforts to get the word out when those openings are there. And then they go through an interview process that usually one council member will send a representative. Last year, Councilmember Palmisano sent a representative to interview with us. And then those names move forward for appointment by the city council and the mayor. The current roster of our members is on the website, and you're welcome to look at the website. I can send you links later if you'd like to see the current membership. So their authority actually comes from city ordinance, and what they're charged with doing is, first of all, to review the MPD policy and procedure to see if there are gaps there, issues that they want to address. The second thing they do is facilitate outreach and training. So that's outreach both in the community and participate not only in training out in the community to let them know what they do and to gather ideas, but they've also participated in projects with us, like a video training project we did for MPD last year to help educate them on what we do, but also to give them some education on report writing, which was an issue that all of us saw both in their case auditing and in the work that we do. They also contribute to the chief's performance review. And probably the most important thing and the thing that they are most known for is their research and study project. And that's related to MPD practice, internal controls, and compliance. And we have all of the full research and study projects on our website, but we'll highlight a couple today. How they get to those topics is a couple of routes. One is from case audits. So one thing that they do during their meetings is to take a sample of cases that have gone through the Office of Police Conduct Review that involve police misconduct. So they look at those cases and look for trends. So for example, we just completed a domestic violence response study. How that came about was there was multiple complaints about officers not writing reports or handling a domestic violence call appropriately. That then triggered the idea to do a study to look at how is MPD doing in domestic violence response, arrest, report writing. So that's one way they can come. The other way is just input from the community, from the Office of Police Conduct Review, and you, city leadership. You can always bring an issue you're seeing in your ward or among your constituencies that you think is appropriate for the commission to address. And to kind of talk about more of the technical methodology, I'm actually going to invite our legal analyst, Ryan Patrick, up.
Thank you, Director Jafar, Chair Cano, Vice Chair Fletcher. The PCOC is really the genesis of a lot of the ideas for research and study, and they work with us in the Office of Police Conduct Review as our professional staff to execute those ideas to really flesh out the idea in a much more detailed way. So they'll meet with us. Typically when they have an idea, one commissioner will kind of take point on that, and they'll meet with our office staff, and we'll help them formulate the topic, really drill down into what they're actually looking into, and formulate specific research questions that we're going to explore. Once the PCOC as a whole votes to move forward with the study, the staff in the Office of Police Conduct Review, and we're a small team of 6 people with a variety of different subject matter expertise, we all work together to actually conduct the research and write the report. The Office of Police Conduct Review staff then presents the results of that research back to the commission, and then once the commission receives that, attaches their recommendations and feedback to it, it's forwarded to the chief of police, mayor, and you, the city council. I think the easiest way to kind of describe the process is to actually look at some of the work that we've done in the past. So the first study that we actually did was on investigative stops. The commission received a number of complaints related directly to people being stopped. Suspicious person stops is the way MPD was coding them. The person felt that they were stopped without cause, and they submitted a complaint to the department. PCOC saw that trend popping up time and time again, so we worked with them and did a statistical test to determine the rate at which officers were documenting reasons for stops as well as demographic information of those stopped. And we were able to conclude with hard numbers that there was a lot of gaps in documentation. We made that recommendation to the chief of police, and as a result, you should check out the MPD's dashboard on suspicious person stops. They've now significantly expanded their data collection in that area, and now we can conduct further analysis on it. An example of maybe a less data-driven study, but more of a best practices study was when the PCOC got a community presentation from a group who had concerns about mental health calls, how officers were responding to mental health calls, came and presented that information with some ideas to the PCOC. We actually explored nationwide innovations and best practices. So we worked with people in New England, people in Texas, partners up in Duluth, to talk about innovative programs they were doing in the field of mental health response. Issued the report, and that actually led to the creation of the co-responder pilot program. Members of the commission served on the hiring committee and have been participating in the draft of the policy for that work group. Now we actually have the officers working directly with social workers in their cars, going to calls involving mental health issues, so that a person receiving that service can actually get service on the site without having to be driven to crisis. It may be a situation where they can resolve it on the spot. So it's an innovative way to deal with those types of calls, get people treatment rather than specifically a law enforcement response. Those are just 2 examples. We've actually completed a lot of different work, and it's all published on our website for anyone to view. So the ACLU requested a study on stops coded as doesn't fit any crime. You can find that on the website. The body camera policy, the initial draft analysis of the body camera project was requested by the mayor and the chief. We conducted that and presented it to the commission. Recently, the complaint filing experience, coaching process analysis, Director Jafar mentioned domestic violence response study. Those are all available, and we look forward to coming back and discussing specifically the domestic violence response study again in the future. And with that, I'm going to turn it back over to Director Jafar.
We just wanted to put up also for you the things that are in process right now, calls for service and evictions related to housing and policing. Where does that intersect? That's turning out to be a very interesting project that we plan to bring back to you. Psychological screening, and then working on the discipline matrix revisions. And that has been a project that has come up and questions from the commission itself. So I'd actually like to bring up Chair Andrea Brown, who is a full-time Ramsey County public defender in her day job and made time to come here today to kind of talk about any of the projects ongoing and tell you about their meetings.
Thank you. Thank you for having me here, Madam Chair and Commissioners. I've been the chair since inception, 2013. In my day job, I'm a public defender, so it's kind of my mission to help my community. I am a Ramsey County public defender, but I live and enjoy Minneapolis. So this was very special for me to be a part of, and I really do appreciate that. I do encourage everyone to come into our meetings. I don't know if you've ever been to one before now sitting at City Council, but I would encourage you to come. I think we are one of the only commissions that allows public comment at every meeting. And so we have some very dedicated public members who do like to monitor what we're doing, but also are just very involved and are on the streets. And I think that that is important for council members to also see, since you also don't get public comment at every meeting that you do have. I think it's a good way for you to be able to hear from the public. I also encourage you, I would love to sit down and meet with everyone individually or with any of our commissioners. We're very passionate. We have a very broad range of people who are on the commission. We have commissioners who are very fully invested in data and understand the pie charts and the numbers and can clarify questions for us who may not have that. I do bring in the criminal expertise. For example, Councilmember Jenkins, when you were asking about potentially what could a situation be where body cameras are turned off and on, I immediately thought of any domestic situation because there's specific policies about that. So that's kind of how our meetings run. If a situation comes in or we're talking about a case complaint, then we have a lot of discussion on that, bringing in our different point of views. I obviously bring in the criminal world. I know what happens to people who may be arrested down the line, and even what the data means with the body-worn cameras and how that represents the criminal world as well as, our community, because a lot of interaction with the police is from criminal complaints and criminal calls. So I think that that's always a valuable voice to have. Besides that, I'm really looking forward to the future of the PCOC. I think we've gotten great momentum. I think we started out strong, but we're really proud of all the researches and studies that we have done, and I'm hoping that you will take my invitation to either meet with me or any of my commissioners, or at least come to some meetings and see what we do. But I'm welcome any questions if you have of me, or I can turn it back. Thank you.
And that concludes our presentation. So we're happy to take any questions that any of you have for any of us.
Thank you, Director. We have, let's see, I'm looking, no questions as of now. Just curious if you could go back to one of the slides with your kind of next steps. Yeah, studies in progress. So can you talk a little bit more about each one of those, especially number 2, because I'm not familiar with that item.
Sure. There were concerns that came up both from on the commission end and the community end, I believe, on what kind of psychological screening were candidates for the police department going through. And both, was the psychological screening, maybe screening out candidates who may be good, and was it as comprehensive as it needed to be, so letting people in who maybe not be a great fit for Minneapolis. So that was kind of that idea to look at that. The calls for service and eviction, we basically got a series of complaints that came up for audit involving tenants who had called the police because they were then having police on the scene as either a response to a call for service. So I need help for domestic violence, or a landlord who calls on a tenant or a neighbor. And then later that property turns into a problem property, which leads to a host of problems, including potential eviction, notice to vacate, and can end up in homelessness for a lot of people, especially the single mother demographic. So that those complaints spurred a look at where is actually the intersection between housing and policing. And we did have a commission member who was just very, very interested in this topic. And then Legal Aid actually came to give a presentation on what they were asking the commission to look into. So it all kind of happened at the same time. And that's where that study's going. So we'll keep you posted and hopefully come back and present that one as well. Number 3, the commission is basically participating in discipline matrix revisions. So the discipline matrix, for those of you who may not be as familiar, it's basically the kind of sentencing guidelines for when and I also come from a criminal defense background, so that's how my brain works, but it's basically the kind of boxes of, if you do violate this policy, here's what you can be subject to discipline-wise. So A is a lower level violation all the way up to D. So right now, the way the discipline matrix is written, it could just use some improvement. And so having civilian eyes, both from the Office of Police Conduct Review and the commission, we thought would be very helpful. So both parties are active in helping reshape the discipline matrix to make it something that better reflects the current climate.
Thank you. So I don't see any more questions here, and I wanted to thank you so much for letting us. Oh, thank you. Okay. We do have Councilmember Palmisano.
Sorry, I just wanted to provide a comment. You know, I think that this commission, the work that this department does is some of the least known work going on in police improvement around, not just in our city, but around. I've been to a couple, not enough, but a couple of your meetings, and the level of depth of the topics that you dive into and the difference in skill set amongst the people that are there, that are your committee members, as well as the way you both complement that, is incredibly impressive. So I just want to thank you and encourage my colleagues to not just attend a meeting, but to really see the great work they're doing. I do feel that they are close to the ground in working on the things that will help us to not just improve our police department, but also serve as a trust builder with police. So thanks.
Thank you. And our door is open. We're happy to talk or meet with any of you as well. But thank you so much for that. We really appreciate it.
Councilmember Cunningham.
Thank you, Ms. Jafar. I just wanted to, this is a comment more than a question. I just want to let you know that I'm actually heading up some work around revamping the conduct on premises ordinance, which is typically used, for the problem property. So I just wanted to let you know that I'm available and interested in working with you and the commission, as however that might show up.
That would be wonderful. And I think especially at this juncture for where we're at in that research would make perfect sense. So I would definitely love to do that.
Great. Thank you so much.
Sounds good. Well, thank you so much, Director, for being here. And thank you to Commissioner Andrea Brown. Okay, for the invitation to come join your meetings. I'm sure you'll be seeing us in the future. So with no further questions, we will go ahead and receive and file this report on the Police Conduct Oversight Commission. All those in favor, please say aye. Aye. And that item moves forward. We will now take up the commercial sexual exploitation work product summary from our city attorney, Susan Siegel, who's been here patiently waiting for her turn. Really appreciate it. Thank you, Susan.
Thank you, Madam Chair and committee members. I know it's getting a bit long, but I will give a special shout out to Andrea Brown, who has a full-time paid job over in Ramsey County and has just done wonderful service, not only to our PCOC, but also she sat in a number of meetings hosted by the Minneapolis Foundation working on police community relations. So she is a wonderful resident of the city of Minneapolis, and we thank her. Okay, where's the full presentation? Can somebody just click that for me, Chris? Yeah, slideshow. Thank you. Sorry for being so inept here. We're going to do this fairly quickly. Commander Schoenberg was supposed to be here along with Sergeant Snyder, but neither of them are available today. But we would all be happy to come back, as a matter of fact, to answer any further questions. So I just wanted to give a brief report on what happened with regard to the anti-sex trafficking response plan during the Super Bowl. There were a multitude of goals, and I think most of them were hit pretty well. There's an after action report being made, so we don't have all the conclusions yet, but we do have some data to share. There was approximately close to $500,000 raised that went into this effort. There was private fundraising, foundation grants from the Women's Foundation. There was a grant from the NFL. So this is private dollars being put into this. This is not tax dollars that went into it. And it was just an amazing collaboration of nonprofits, law enforcement, government partners, you name it, and obviously business partners. This slide was put together by the Women's Foundation that helped lead a lot of this work. And it's kind of a busy slide, but it captures in one slide, which I could never do on my own, some numbers. So I think one of the more impressive numbers here is that there were over 15,000 people who received training, in-person training by Beth Holger Ambrose herself from the link, or another very knowledgeable, experienced trainer on what are the signs of sex trafficking, what to do and who to call. And those people will be here and remain here in our community. So we've just added eyes and ears. Almost 3,000 people were reached by street outreach workers. And there were shifts added by, again, trained, skilled workers in working in this field, both with youth and adults. And I think one takeaway is that that would be a wonderful thing for us to look at, keeping some of that going and helping figure out ways to fund that work. Lots of communications out there in terms of prevention and where to go, what to do. 727 calls were made to the sex trafficking hotline. There was one really good thing, I think, too, is that there's a lot of energy around and a lot of people who want to help. And so that was funneled in a really positive way into fundraising or supplies that were actually needed by the service provider. So it wasn't a lot of wasted energy. 2,100 youth were provided, for example, with survival kits. 3,600 men were trained on the harm caused by sexual exploitation, and on and on. I'm not going to go through all these details. The two campaigns that ran, one of which you saw in the prior presentation before the Super Bowl, was the I Am Priceless campaign, which was developed by youth survivors of sex trafficking. And then one geared at ending the demand from buyers. Law enforcement, briefly, MPD was involved in arresting 94 men during the Super Bowl period, and 45 of those were felony cases, meaning there was solicitation of kids, people under the age of 18. 28 victims were also connected to services. And as I mentioned already, there were over 15,000 people trained, and a whole variety of people, not only our own staff, neighborhood organizations, faith organizations, Airbnb providers, along with the 10,000 Super Bowl 52 volunteers. So as I mentioned, this gap analysis is in process now. some of the known takeaways, and Nigel Prode is here and is going to be talking a little bit as well. And then we're also lucky to have Lauren Martin here with us, from the research director from UROC, who currently is in charge of the research being done by the Minnesota Department of Health on exploring models to expand the safe harbor law to include adult victims of commercial sexual exploitation. So known takeaways, there are real benefits to having street outreach there, but again, it has to be knowledgeable, skilled people who know what to do and also know where to look. There are no shelters available for adult prostituted persons. We've got a few now, not many, but a few for juveniles, but nothing is really available. The closest are the domestic violence shelters. We know we need greater outreach in LGBTQ communities and more regular training outside of large events. Ongoing work. The city I led the application for, and the city received a grant that'll pay for a 2-year fellow. The job position has been posted. I think we got 38 applicants, so we'll start interviewing for that, to work on human trafficking, both sex and labor trafficking, to really help further our plans and efforts in the area of sex trafficking and begin to develop a plan around labor trafficking. The city, has its ongoing work with investigations, recovery of victims, and building services. As part of the 2018 budget, well, 2017 and 2018, each year, $25,000 has been invested in services and housing for juvenile sex trafficking victims. The health department, environmental health, is working on amendments to our city ordinance to provide additional health-related protections for adult entertainment workers. And then, of course, we've got the Final Four coming next year. So figuring out the plan for that event to keep this momentum going. I'm going to turn this over to Nigel now as we move into talking more generally about commercial sexual exploitation with a focus on East Lake Street.
Thank you, Susan. Just for the record, I'm Nigel Prode, I'm Youth Development Coordinator with the Health Department. Also wanted to just clarify too, in terms of ongoing investments, currently $75,000 is being put into this targeted outreach on the East Lake Street. Last year we had $75,000, and we have an additional $25,000 one time this year, and $50,000 going ongoing for the next, well, indefinitely until that gets taken away or changes priorities. But with the commercial sexual exploitation outreach within the Lake Street area, we are partnered with 2 community partners, the Family Partnership and the Minnesota Indian Women's Research Center, that is doing kind of a 2-prong approach to the type of outreach they're doing. They're not just working with the victims that are impacted by commercial sexual exploitation and sex trafficking, but they're also working with the community as well to develop ways and strategies that the community can be more constructively involved in the response, as well as Susan Siegel pointed out a few times, the need for experienced and skilled outreach workers is important. And I know that many community members realize that this is a huge issue and is dear and near to some of their hearts. Sometimes they are putting themselves in situations that may not be the best safety for not just themselves, but also the women that they're reaching out to. So it's really important that in the solutions to this issue that we involve community in a way that is constructive and supportive of the agencies that we're working with, but also the women, primarily the women and the victims that are being impacted as well. Over the last year in this project, we had 166 people reached through outreach, 9 engaged in services, and 178 community members that are engaged through a variety of different events and meetings through neighborhood associations or safety committees as well. Moving forward, the project will continue working on developing these strategies and have implemented some community-based strategies already. So, for example, within some neighborhood watch associations, they've done trainings with the neighborhood watch associations and the best way to approach and identify victims in the community. They've also are looking at ways to be more strategic about the outreach that they do in terms of like high times of the day, different times of the day, different times of the weeks, different times of the year even. As part of the Super Bowl, the outreach team did put on some more shifts during the Super Bowl just in case of there was a need for more resources or anything like that. And so they've been really good at working not just with between the agencies, but also with the communities, other community stakeholders as well, police, business associations, neighborhood associations, things like that. All right, I'll turn back over to Susan.
Then with the leadership of our committee chair, Councilmember Cano, our office developed a pre-charge diversion program for prostituted persons, and again through Pride and Minnesota Indian Women's Resource Center. And the 3rd precinct, their focus in 2017, this was under the leadership of Inspector Catherine Johnson, who is now the head of County Community Corrections, our current inspector, Mike Sullivan, Lieutenant Gary Nelson, and the CRT Sergeant Matt Severance have really done amazing work. And for the first time, they developed promotion of prostitution cases, and 5 are charged. They're felony cases. So they have figured out how to go after the people who are the most responsible for this harm. And it's just really impressive work. And there were also arrests for 83 sex buyers, gross misdemeanor charges, along the East Lake Street corridor. I know the chair wanted us to talk a little bit at looking ahead to budget and funding in the future. What has the city invested? And so out of pocket is the $75,000 for street outreach and engagement, $25,000 for services and shelter for juvenile trafficking victims. And then we have an up to $25,000 amount in this contract with MIWRC and Pride for this pre-charge diversion program. Minneapolis Police Department has 2 full-time investigators dedicated to juvenile sex trafficking. And then we will, as soon as we can hire this, we will have 1 full-time FTE to lead our efforts in this area, funded through this grant, Pathways grant, plus time put in by a lot of staff from business licensing, health department, obviously Minneapolis Police Department, us, and others. And with that, are there any questions we can help answer?
Chair Cano? I don't have a comment, but, I just want to say how important this work is and how impressed I am that you guys are doing it, and really, really impressed that there is an awareness and a focus on LGBT communities, as well as, and in particular, trans identified people who I believe, and much research has shown that people are being trafficked, from a societal standpoint. And also the thought process and awareness around shelter and housing as some of the factors involved in people being sort of forced into those kinds of situations. So just want to say thank you for the work and the efforts here.
Thank you for all of your support for this work.
Councilmember Cunningham and then Fletcher.
Thank you so much. I was curious about the particular the particular amount of the overall numbers that we see and like how that compares to the number of folks who have been utilized the services and things like that. I was just curious about how does that look and how we can support scaling that.
Madam Chair and Councilmember Cunningham, I don't think we have a good handle yet on the numbers out there. Sergeant Snyder might be in the best position. I don't know, Nigel or Dr. Martin, if you have anything you'd like to add on that question. I don't think we know exactly. We know in particular pockets of the city, East Lake Street tends to get attention because it deals with an issue that's out in the open on the street.
Yeah.
And there's a lot of hidden activity that goes on here online, you know, in places that are not quite as obvious.
Yeah.
Chair Cano, Councilmember Cunningham. I think the other important thing to think about that too is oftentimes people don't recognize their involvement as victimization, so they might not identify themselves as victims as well. And I think Councilmember Jenkins, you kind of touched on this point too, is a lot of the there is some visibility issues with a lot of people that are impacted by this in the trans community. Oftentimes are not visible within the services being provided because oftentimes service providers either lack the skills or the education to do the type of care and support for trans victims. And I think also there's another component too, is oftentimes I just had a chance opportunity yesterday to meet with a group of outreach workers that are doing some work specific to working within commercially sexually exploited youth and sex trafficking. And one of the things that was brought up in that meeting is oftentimes involvement by trans people within the commercial sex industry is oftentimes one of the very few places where they are affirmed for their identity, and really that says a lot more, I think, about the larger community and the lack of visibility than it does say about the involvement by trans people in the commercial sex industry.
I actually have a follow-up question. So how is someone classified as exploited versus someone who has been relegated to the margins and has to engage in the survival economy? How is that being differentiated in this particular framing, or is it?
I have been using it in very broad framing. So whether it's sex to survive, to have a place to sleep at night, I think we have to be concerned about the whole realm. So I tend to use it very broadly. Researchers probably when they're doing their research would have more clear definitions, for accuracy, so what it is they're studying and what conclusions they're drawing about what. But I think we have to be concerned about that whole realm of from survival activities to whatever other forms of exploitation are there.
Chair Cano, Councilmember Cunningham. Typically, the way I've always approached this and the definitions that I utilize is I think commercial sex exploitation is a better catch-all for those that are trafficked. There is a specific crime and act with trafficking, and it usually is the third party that is the one that's being the exploiter to the victim. Whereas I think when you utilize the language of commercial sexual exploitation, you're also recognizing those that are involved in sexually exploitive situations that are there because of survival mechanisms. So I think it's a better catch-all. And it's, I think, oftentimes, at least in my experience in the work that I've done with youth, it's more accurate that a lot of times kids don't choose or youth don't choose this life. It's oftentimes a matter of survival and the fact that they have to make the decision of either I freeze and stay out in a cold Minneapolis night, or I put myself out there and sell myself so I have a place to stay for 1 or 2 nights. I think it's really important that the broader that we could be in the language that we use, I think it is more important because there is, I think there is a lot to be said again of the choice that oftentimes is being made is not a choice that they're making because they choose to make it. It's being made because oftentimes the situation requires it. Again, if you're looking at survival sex as a means to survive.
Councilmember Fletcher.
Thank you, Madam Chair. I just have a comment. I just wanted to echo my colleagues' comments about how important this work is, and particularly lift up the focus on getting upstream to the advertisers. I think that's really exciting to hear about some charges being filed from people who are profiting from this activity and who are kind of driving this activity. I think the more we can get to the root of the profit center and be sort of strategic and tactical about that, the more progress we're going to make. So I appreciate that work. I just wanted to lift that up.
Councilmember Ellison.
There was one slide that really caught my attention, and correct me if I read it incorrectly, but you said there were 94 arrests during the Super Bowl, for instance, and that 45 of those arrests were for folks who are attempting to purchase sex from minors. And I just that really stuck out to me as is that a representative sample size of how the industry goes in general, or do you think that's uniquely large, or
Chair Cano and Councilmember Ellison, I don't think it's uniquely large. I think we had a larger number of law enforcement enforcing, doing these things during this time frame. But the sad truth is, I think on any given day, if you put additional resources into it, you would have not insignificant numbers. I haven't looked lately on Backpage. I used to go, when I was doing presentations or doing, just working and wanted to see what was going on. I know back a while ago, just for Minneapolis, on any given day, there would be 20 new posts online, by 8 a.m. or something. I mean, it is, Councilmember Fletcher was getting at, it is a whole societal shift, and not only making sure the resources are there for at-risk kids to prevent this, but also moving on the demand side.
Yeah, I just wanted to highlight the 94 arrests, 45 minors. That was. I just wanted to make sure that didn't get lost in the shuffle. So, yeah, thank you.
Oh, thank you.
All righty. Without further questions, we will go ahead and receive and file this report on commercial sexual exploitation work product summary. All those in favor, please say aye.
Aye.
Aye. Thank you. And that moves forward. And our last presentation, which we need to get done in about 4.5 minutes, is the City Attorney's Criminal Justice Reform Initiatives. And if we do need more time to discuss and delve into this issue, we've got more meetings at in the following months where we can do this. But I do think that we have an Enterprise Committee meeting at 3:30. So hopefully you can breeze through this presentation, Susan. And
I will just I will breeze through it really quickly, we would like to come back actually and highlight a few of the more exciting things. I'm not, in light of the time, going to go through all this, and maybe I'll just focus on. So what we've been focused on most recently is separating out the ability to pay from criminal justice system consequences, so that you're not suffering a more severe consequence than anybody else based on your income level. And so we've done bail reform work. We're doing more around that issue. Just yesterday, I had the opportunity to testify in front of the House Transportation Policy Committee on the bill that the city, you can take a lot of pride in this, that the city is lobbying for, so that driver's licenses will no longer be suspended just for failure to pay fines. And I am very happy to report, at least at this first committee, that there is strong bipartisan support for it. The other is reducing the use of jail, unnecessary use of jail. Obviously, there are some violent individuals, who, you want in jail, but for a significant number of people, we can more sensibly reduce the use of jail, reduce collateral consequences of the system, and then something that we've been doing for a while with real success is achieving reductions in recidivism by addressing the underlying needs instead of just focusing on punishment. I'm not going to go into all this detail and see if there's anything in particular I want to focus on. We've increased our diversion numbers and we'll continue to do that. We've expanded programs in that area. And one thing I do want to, we'll do this at another time. This is just an example of how we've achieved these long-term reductions in recidivism by using social services, housing, chemical dependency referrals, and the like. And then this, I would like at some point to invite the Urban Ventures people in with us to present on this Pathways to New Beginnings program, dealing with gross misdemeanor weapons offenses. And it's a unique program. I think it may become a model elsewhere, but instead of sticking people in the workhouse, they're getting some intensive programming based to what their needs are through Urban Ventures. And it's community-based programming, trauma-informed, really meets these young men where they're at and dealing with their needs, what they need. We now have 22 defendants who have been referred. A couple of them have been dropped from the program for repeated failures. I mean, if it, we want people to stay with it, so we try to steer people in that direction. But I think it's got a lot of promise, and at an appropriate time, I would love to come back and present more. And with that, I think it's probably beyond 3:30, so I will stop now. More to come.
Thank you, Susan. I really appreciate all the work you've been doing on this front. I just want to seek the advice of the city clerk. If we want to continue this conversation at our next meeting, the motion would be to not to receive and file, correct?
You could just motion to continue this item to the next meeting.
Okay, so yeah, we can just do that. If you do, you want to make the motion? Sure. Councilmember Cunningham.
I motion to, continue? I motion to continue this conversation at the next meeting.
All those in favor, please say aye. Aye. Thank you so much. Without further business, we are adjourned. Thank you, champs. Public safety champs. I promise I'm going to get this timing right eventually. So yeah, I was bummed.